Good afternoon, ladies and gentlemen. Thank you for joining me at Ackermann Alignment Clinic. I'm coming to you live from my new centre in Vung Tau. It's in South Vietnam, and it's in the beautiful city of South Vietnam, and it has quite a unique history. Very interesting. Today I'm going to be talking to you about Ackermann alignment, restoring balance. You know, we hear quite often that that everything must be in balance, and it's true. You know, you have negative, positive. You have your positive ions and negative ions. I'm talking about the atmosphere. I mean, even in human relationships, you know, it's important to recognise that a good, healthy relationship is to not be joined to someone who has identical thoughts or identical passions to what you have, because you know that's part of the balance. Yeah, it's important to balance our. It's important to balance our life, yeah. So, restoring balance is really an interesting topic, because restoration is what everyone requires, especially if you've been sick. And you know, in my hands I have a matrix, bone matrix. And of course, encased in that bone matrix is the somatic nervous system, the autonomic nervous system, the voluntary and the involuntary nervous system. And it's this nervous system, the nerve network that that the entire body is relying on. So, and that brings us to Ackermann alignment. Ackermann alignment. You know, the skeletal, the vertebral body is a complex structure, and the matrix bone system is able to create various disturbances with that nerve flow that becomes distributed out through the organ systems. And so we're talking to you about motion, increasing circulation, talking about reducing swelling and pain. Pain is the autonomic nervous system. It's a signal system that your body is telling you. It's a story that your body is telling that, hey, something's not right and we need to get this fixed. Yeah. So as a practitioner, as an Ackermann alignment practitioner, I want to offer you the opportunity to come to our centre, and there we can help to remove this nerve irritation in your body. And we do that through a variety of different techniques, whether it be musculoskeletal, whether it be nutritional supplementation, nutritional dietetics, whether it be through phytomedical herbs that we use. These are all techniques that are able to be utilised to help your body become restored, yeah? To restore you from ill health into normality, which is basically homeostasis. I'm talking about homeostasis here. Homeostasis is the normal functioning, it's the normal messaging, it's the normal, it's a balanced communication in the body. And so the Ackermann alignment technique, it's a science, it's an art, it's a philosophy. It's very different to the American chiropractic technique. The American chiropractic technique is specifically related to only the spinal column. Okay? So you can see on the chart, on the chart here we have a full, complete spinal column. Now, in osteopathic medicine, we're not only interested in the spinal column, we're also interested in the occiput, we're interested in the scapula, we're interested in the supraspinatus, we're interested in the trapezius. These are all the muscle groups. These are the muscle groups that the body utilizes. Yeah. So this is just a picture of the muscular system, both anterior and posterior. So abdomen alignment technique also relies on myofascial tissue work, deep tissue myofascial work. Okay. Myofascial, myo means muscle, fibre, fascial means the sheath. So consider a sand inside a sock. Yeah, the sock is the fascia, and the sand is the muscle fibers, the individual muscle fibers. So that's the uniqueness of Ackermann alignment. We're not just focusing on the skeletal part of the anatomy of the body. We're also interested in the fascia, which is the sheath that contains the skeletal system. Yeah. So I think what you must understand is also and this is the science, I'm talking about the science of myofascial research. Pain and swelling is related to myofascial trigger points, which is a hypersensitive bundle of nerves and coagulated fluid in the muscle tissue. And what happens is that these myofascial trigger points, they create a nerve synapse, or rather a nerve reflexogenic condition that trigger other muscle groups to not function as they normally should. At another day, I'll go into this in further detail, but I just want to let you know that we are addressing abnormal strain patterns, which is caused by these myofascial trigger points, muscle and joint imbalances. And now, this technique was designed by an orthopedic surgeon, Dr. Ackermann, whom I trained and received my master's in chiropractic treatment through the Ackermann College in Stockholm, Sweden. And so this technique is a very advanced technique because not only does it work with pre-surgery, but it also works with post-surgery as well. So I'm not necessarily saying that you need to have surgery to come to our clinic. I'm just saying that the training of Ackermann alignment is we have post-operative and pre-operative surgical training, okay? Medical doctor training. So, yeah, moving on, what you should understand is that flexibility and mobility is really important to have support, yeah, to maintain support for your body. Now, I'm actually a fan of boating, would you believe that? This is my favourite picture of one of the most famous racing boats in Australia. It's a world champion racing yacht. I am privileged to be able to say that I helped design and I helped build this most fascinating racing yacht built in Australia at Mona Vale, Sydney. And we are living in a beautiful boating district. We're living in Vũng Tàu, South Vietnam, and it is here in South Vietnam that a lot of people love to boat. We have a lot of fishermen in this area, and I just want to let you know that the technique that we offer here is able to help any person who has an issue with boating injuries, yeah? Okay. So not only boating injuries, but also Muay Thai kickboxing. I'm actually the sports medicine doctor for Team Australia, Muay Thai kickboxing in Australia. So tennis injuries, kickboxing, golf injuries, sporting injuries, all of these injuries that occur in volatile sports, yeah? Competitive sports, we're able to help you in that manner. All right, so let's talk about subluxation. Subluxation is abnormal postures. Abnormal postures. I mean, the secretary that's sitting at the computer all day. These are people who have repetitive strain injuries. These are people who are consistently maintaining the same alignment, and unless that alignment is altered, well then you are going to have a repetitive strain injury. And so it may be a truck driver, it may be a bus driver, it may be people who are consistently in one position. These are the type of people who have abnormal postures and subtle repetitive movements. And so injuries, accidents, even people who have an emotional problem, people who get upset easy, people who have arguments, people who go through personal traumas. We are all open to these type of conditions. We are all open to arguments and work pressure and life and career changes. And so that it's important to remember that Ackermann alignment helps in that particular case. Also, we can talk about toxins, food additives, various chemicals, solvent chemicals that are used in medication, cigarette smoking, many other pollutants in the environment. All of these things are related to what causes a disturbance within the gene, the Homo gene. So your spine is consistently storing up tension, and so the idea is that once we're able to get this spine moving correctly again, you will then notice a big improvement in relation to your health. So mobility, flexibility, and posture are all related to reduced spinal function. We're talking about reduced spinal function, and subluxations is what causes spinal wear, it's what causes degeneration. Yeah. Spinal pain is also related to, maybe it might be referred pain, such as headaches, inflammation. Inflammation is where the joint becomes swollen. We're able to help in that condition. So, yeah, I just want to finish off with letting you know that Ackermann alignment helps on a number of these features: physical, mental, emotional, or chemical. Okay? So you must remember that the nervous system, it has the ability to release fake, false chemicals, okay? False chemicals in the body. So what I'm talking about is this, is that there are synthetic chemicals and there are natural chemicals in our body. Synthetic chemicals are those chemicals that saturate us in today's environment. And so these synthetic chemicals, what they do is they create a disturbance within the nerve network, the nervous system network. We're able to fix that, we're able to modify that. All right, minor stresses can also have a major impact upon your body and your health, and especially if they are repeated or constant. So this is Jay Hunter signing out from Boomtown Chiropractic. Look us up, let us know. We're on Zalo 01212061909. Zalo, WhatsApp, Viber. Yeah, please, if we have a free consultation available at 800,000, which is roughly about $50. Yeah. So we're giving a free $50 consultation analysis, spinal analysis for our new clinic in Boomtown. So look at the number, yeah. I should be pointing up above. Look at the number above, yeah, in the Facebook link, and give us a call, and yeah, we'll fix you up an appointment straight away. Ciao.